So I just want to welcome everybody to this Lunch and Learn. It's presented today by Leanne Patel. She is a nurse educator, a registered nurse, and also a per diem chaplain. She has a lot of experience in medical settings and in community-based public health. So I am going to turn it over to her. I am Mary Ann Brody, and I'm the executive director of Crossroads of Caring and also an ACPE educator. And I work with our clinical pastoral education program and with our other programs, the Lunch and Learn, Equipped to Care, and the Journal Club. So I'm going to turn it over to you, Leanne. You can continue introducing yourself, give more information if that would be helpful, and then we're all in your hands. Thank you for being here.
I am Leanne Patel, as Reverend Brody said, and I want to, first of all, express my thanks for being invited to facilitate this Lunch and Learn and present to you all. I'm very happy to see you all here. Thank you for joining. And I also have to say, I'm happy that we're an intimate group, primarily because this is my first, believe it or not, facilitation of a Zoom meeting. I most prefer to be with people in a group that, I'm in their presence in live time, but it's okay. We all stretch ourselves and try to learn different things. So this is my chance. And I'm very happy to see Dawn. We were students in CPE together, so it's a pleasure to have Dawn with us. And Maureen, I'm very happy to have a nurse colleague here. So it's a perfect group for this discussion. So go ahead, sorry.
No, I just want to say if people have questions or comments, I'm going to be monitoring the chat for Leanne. And if you don't feel comfortable raising your hand or interrupting her, I will do that for you.
And I don't mind. If you have questions along the conversation, please just jump in and, we can talk that way. Dawn, I wanted to ask you, I don't know if you heard when our discussion earlier, it was difficult accessing the articles. Were you able to access the articles?
Sorry, I'm still getting used to this.
That's okay. That's okay.
I didn't have any problem, so thank you.
So that's good news. That's very good news. So it's probably going to be you and I holding this down today, our Zoom meeting, Dawn, because you at least have looked at the articles, and we'll be able to have great conversation anyways. Because again, sitting here with me, you all have lots of chaplain experience. So the one thing that I would really encourage everybody, if you can in your free time, one of the authors is Dr. Elizabeth Johnston Taylor. She's an RN, also a PhD, and she's also a chaplain. And she teaches at Loma Linda University. When I was preparing for this meeting and looking at the literature, there really is not a lot of literature from the nursing standpoint about collaboration between nurses and chaplains. And she talks about that in some of her work. So if you just have a chance to look at her work, she's done many studies outside of the country too. Her background primarily was in oncology, but again, she's visited different cultures and done research with them. So I have found it very interesting to read what her work is, and I think you guys would too. The other article is written from Larry Vandekreek, and he's Dr. Vandekreek, and he's has his doctoral degree in ministry. I'm sorry, I'm not going to give you all the credentials, but again, it was nice, those articles I chose just because you had both perspectives, the nurse and the chaplain with that kind of traditional seminary background in that. So it was very nice to have that balance between the two. The one thing that I would ask Dawn, if you recall, and there's no pressure, it's just to kind of get the conversation started. The one article, How Can I Improve Collaboration with Chaplains? That was the one by Dr. Johnston. How was there anything that popped out for you that, or I guess a better way to ask the question to you, did you learn anything new looking at that literature?
Well, so from what I was reading, it was very familiar
Yeah.
because I've dealt with so many different aspects of that with hospice for 16 years, with lifetime care, you know, not only with CPE, obviously, that you and I know, but also then now at Newark Wayne. Many of it was very familiar. I don't know how to say it other than that, other than the fact that I could see being a part of what was being talked about. So I don't know if that's what you're looking
Yeah,
for,
that's
Leanne.
okay. No, it's a good start. I think what I loved most about the article was that her words, she said, nurses are the spiritual care generalists and chaplains are the experts. And I love to see that because I think that in nursing really doesn't consider themselves to be generalists. Again, my little sort of exploration as I was preparing for this was just in conversation with my colleagues that I would ask, so what do you think about this? Tell me about your participation. Where do you feel you fit with referring to chaplains and collaboration with the chaplains? The other question that I was asking, again, very informally, it was in a cup of coffee with somebody or at the end of the meeting with somebody, asking about curriculums. In nursing curriculums, what are we teaching? What are we exposing our nurses to regarding spirituality? Everybody was very, very easy to say, oh, yes, we do that. Yes, we do that. And again, without naming any names, I spoke with 3 different schools of nursing. Again, these are friends and colleagues. It was very informal. And that, yes, we do that. Where do you do it? Or how do you do it? Or tell me. It is so brief. And really, it was like you'd look at a curriculum and this much, they'd show you, you know, this much of a outcome. It was shocking to me because, again, that's something that we all kind of assume that we know, but the formal education part for nursing regarding spirituality is very, very limited. Now then we bring that to the fact of how can we collaborate if we first don't understand what it is that we need to be doing, right? And secondly, what's the role of the chaplain? So the articles talk about that too, that often nurses are not familiar what their role is. Often nurses don't understand the background of chaplains, and that kind of is a little bit of a barrier because they don't understand what it is that chaplains can do. It seems to be the consensus is always in a crisis, we call the chaplain. If there's a traumatic event, the nurses are thinking to call the chaplain, but it's only seems to be, and again, when you look at the literature, that it's not when they're at the bedside, that might not be the first thing that comes to mind. Remember, I'm talking very general terms. The literature will support the different things that I've said if you guys start looking at it. But again, if we as nurses don't understand fully the role of the chaplains, that's a little bit of a block to us reaching out to the chaplains. The other thing that I think happens, or what these articles talked about, was nurses, the chaplains often refer to the nurses. She did a beautiful study asking about, this isn't the article, but it's just part of her work that I looked at, asking the chaplains what they felt regarding what might be barriers or obstacles to their collaboration with the nursing staff. And almost half in this survey revealed that they often looked at the nurses as gatekeepers, that were there gatekeeping and kind of protecting the patients from the chaplain. That was very surprising to me. I don't know if you remember that part, Dawn, but again, as a nurse, I never look at myself like that. So to hear, like, but I also will tell you, yes, I am protective. I'm very protective of those that I'm caring for, but never in regard to the chaplain. So maybe there's that own individual piece too with nurses, their own spirituality. What's their own maybe participation in any type of affiliation or something like that. But that personal bias might be a part of all this too. So I would like to ask at this point, for your own personal experiences, have any of you, or maybe let me ask it this way, what can you speak about the positive interactions you may have had with nursing? What I mean is a particular incident where you found that collaboration very deep. I'd like to start with the positives first, if we could.
So I can speak. I was going on a visit with a student actually earlier this week. And we were in a room with an elderly woman, and she was telling us about how she was ready to die.
Oh.
And she had her will made out. She was 91. She had signed the DNR. She was ready to go.
Okay.
But she was getting better. Like, so it was really interesting. But the nurses in the room were great. Like, they didn't try to talk her out of it. They just listened, and they made such nice observations about, oh, you're looking good this morning. And I know you're in some pain, but it sounds like your son is a great, you did a great job as a parent. Your son is so caring. Like, they came in with some very heartfelt affirmations that I thought were really nice for her to hear, especially as she was kind of looking back on her life and thinking, I'm 91, this could kill me. And I'm ready to go. Like, I'm okay with it. And so I thought that was wonderful because, I look at nurses, doctors, their goal is to heal.
Mhm.
It's not to ease people into dying. It's to heal them and to get them out of the hospital. And that's what they were all talking about. And they were all being very positive with her. But so I like that. That was a great encounter with the nursing staff. And they gave us a lot of space until they actually had to take her down for her x-ray. Like, they waited for us probably a good 5 minutes, which I think is gracious because I've been in a lot of rooms where they rush you right out. And they just calmly waited and joined the conversation, and it was really nice.
So 2 points, thank you so much for that, Mary Ann, because one of the points is that came up about time. That's at time, the nurse is protective of their time. So the chaplains were hoping that that could be something that could be scheduled in. Find that time and then have that time be really just focused with that chaplain and the patient without the nurses interrupting, the nurses in and out. And now more than ever after COVID, that's very challenging because everybody's so busy. So to hear you say that, I think is great. I think that's great. That clearly they took the time until they had to go to the test, and that was okay, until the patient had to go to the test. The other thing that I thank you for mentioning too is you hit the nail on the head. That's a little bit of, I don't want to call it a barrier, but nurses are needs driven. And so if we go back and we think about Maslow and that hierarchy of needs, that's what nurses are concerned about: breathing, bleeding, pain. So that spiritual component, though we know it's important in our list, it's probably not on the top, right? The nurses are thinking of that needs. What's the immediate physical need, as you said, of that particular patient? So it's not that nurses don't understand that spiritual component, but it might not be a priority. And hence that's where it goes to, like, okay, if it's a crisis, if there's a crisis situation, then it does become a priority. But until then, it might not be. So there's that little bit of kind of incongruency, again, just to try to understand what those barriers might be. Maureen, do you have anything like a collaboration that you felt helpful or was particularly beneficial for you as a chaplain?
I can think of a couple of things. One thing that changed at the Arnett actually last year, and it's continued through this year. We have a couple. We're a clinical site for a couple of different nursing programs, and 2 of them, the student nurses come and shadow a chaplain for a day.
Oh my gosh.
Which actually it's great to help incorporate that understanding of what chaplains really do. It's not just to come in and say a prayer. but really are part of the healthcare team. But it also helps recruit nurses because once nurses understand the role of a chaplain and the culture of an organization that values chaplaincy, like we're fortunate at Arnett that they do, they like to come and work with us.
Oh,
So that's a very good thing.
oh my
And I
God.
always I like to honor my ancestors in healthcare. And when I went to my first nursing school many, many years ago, it was a hospital-based program at a Catholic hospital where we had a priest on site 24 hours a day, 7 days a week. And they truly were gifts from God because they functioned as interfaith clergy and would see patients at all times of life, all moments of life. And that sort of inspired me in my nursing career to incorporate spirituality into my practice throughout my life. So, I've seen some great collaboration.
Yeah. And I think that's such a great, I am so happy to hear that. Maybe offline, Maureen, we could talk. I'd love to know those nursing programs that
Mhm.
are doing that. We have nothing like that in our area. There's none of the schools, and it's always, time. We don't have time. We have to teach all these other things. So yes, we
Mhm.
recognize that spiritual dimension of those that we're caring for, but making time to bring that in. What a great opportunity. Just chaplain, let them shadow the chaplain for a day. Even if the whole class can't do it, maybe a couple of them. This is a huge thing to, again, enhance their collaboration between.
And it helps the chaplains understand what nurses are
Yes.
learning and making also. Yeah.
Wow, I am so excited to hear that. That's wonderful. And I hope we can talk about it more because I just
Be
think,
happy to. Yep.
and how fortunate for you, because you'll be a part of that, right?
Mhm.
Wow, that is so good, so good.
One
And
thing-
again, what a great piece you'll bring to it, having that nurse chaplain,
Mhm.
experience. How about you,
Yeah.
Dawn? Oh, I'm sorry, I didn't mean to cut anybody off.
No, I just wanted to say that I know one of the things that came out, because we did some shadowing with medical residents, not nurses, at Sisters. And one of the things that came out of it was they didn't even know that chaplains charted. So,
See?
they didn't even know to look in the chart to see what was there.
Right.
Of course, then as a chaplain, I'm like, ooh, I better write good chart notes. Because if people are going to
Exactly.
start reading them, there better be something of value in them, not just I stopped by, we prayed. Like you got to have something of substance there that matters to the medical community, like to show your part in the healthcare team, which I think is great. It makes you step
Mhm.
up to the bar.
I love that. And that was in one of the readings that I had looked at too, that many of the physicians didn't know, just like you said. Well, I don't know, chaplains even chart. There were also physicians that answered that reading a narrative, yeah, it really didn't matter. They could just click off boxes. That the physician said, no need to read a whole narrative. The same thing could be accomplished in just clicking off in a checklist. And I was like, oh no. So I think that shows us the need for that education. What do chaplains do? Not only that, but how did we get to that role? We're just not volunteers. We've studied. It's just like, going to nursing school or going to medical school, that there's a academic educational piece of this too. And I think that that's one of the huge things that maybe we could change as chaplains in our facilities, wherever wherever we're working, so that staff understands what we are, what we can do, who we are, and importantly, our background. How did we get to this place? We just didn't wake up one morning and say, I want to be a chaplain and look for a job, And Dawn, can you add anything to the collaboration piece conversation?
So back to your question about a positive experience,
Yes.
I'm going to go back to that. So this is kind of a positive and a negative. So I was called to, and it wasn't at my current location. This was a while back. But I was called in because the situation with the patient was being added negatively to the conversation of death. Okay, so this is hospice. And so I walk in with the nurse when I come in, and she said, gosh, she's so agitated and we just want to calm her down. And as we're both walking in, the nurse that was in there was saying, you're going to die. I mean, she was just out and out telling this woman, you've got to accept it. You're going to die. And this woman's like, no, but I don't, I've got so much to do. And so the nurse I was with very nicely, very professionally said to that nurse, said, you know what, the chaplain's here, we'll take it from here, whatever. And so the gal left, and the nurse that I came in with went over and just touched the woman and just said, the chaplain is here, changed her whole voice, her body language. You could tell that she was calm versus, the other nurse was very energized, and so and she said, I just want to introduce, Dawn, she's the chaplain, she's come to visit. And I went on the other side, did the same type of thing. And within a few moments, it did not change the outcome of what this gal was going through, okay? But it changed the quality of the outcome. And I don't know how to explain that either. But what happened then was her whole body relaxed. Not only did the nurse give her genuine self to this lady, the compassion, but she also gave me an opportunity to start that conversation with her. And so I saw also not necessarily negative, but I saw that, what the first nurse brought to the table. And that is, well, you're going to die anyway, let's get this done, let's go for it. And then just changing out the people and the attitude and even the tone and the voice. So I thought I'd offer that example up as a kind of a pros and cons. I mean, they were both doing their job and they were both doing a great job. It's just how they were doing it with the compassion that was offered. So thought I'd offer.
Thank you, Dawn. Thank you, Dawn, for sharing that. And it's unfortunate that sometimes those are experiences at the bedside that, we see professionalism or interaction or lack of professionalism in a way that's challenging and difficult. But it seems to me that the second part of the situation, that nurse was really able to be present, simply
Right.
kind of take that initiative to be present for their patient, listen, calm, just be there. And again, those are things that nurses are very capable of as chaplains, but that collaboration in that team, that even within that one nurse recognized, oh no, this is not going well. And she could take over to ease you in to the role of being at the bedside with the chaplain. So I thank you for sharing that with us. I think the other thing too, that I kept seeing in the literature, well, these two articles, not all the literature, believe me, I didn't read it, but there was a lot of couldn't look at it all, but there were a lot of articles that I pulled out for later, is that lack of knowledge that nurses, and it's a lack of knowledge, and I'm not saying that in a critical way, but the nurses don't often truly understand how much that chaplain can be supportive of that patient's care needs, spiritual care needs, and help us also even, having that presence of the chaplain just to be what we know. That's what we know as chaplains. We just be there, just be at the bedside. But the nursing staff, I feel, coming from the article, looking at the articles, if there are ways, and again, Maureen, she didn't look at the articles, but you are such an important piece of this. I can't believe this. What an easy way to have not only, and again, I wish it could be possible, but even how about could we have during the orientations, do chaplains go? Is that part of the orientation at facilities that a chaplain can go and talk about? Hey, I'm the chaplain. This is new staff, new nursing staff, new medical staff. That chaplain presence, we have to go through all the particular, how you have to take a class for this and you have to learn about how to chart in the electronic medical record. Could not the presence of the chaplain, a little introduction, or let's just meet the chaplain, be part of that agenda so that staff, right from the beginning, become aware of, this is the chaplain at our facility, this is what we do, this is how we can support you and be true team members. That's one thing that I thought about. The other thing I think that came out was that continued communication. By that, I mean the chaplains rounding. That I don't know who's doing that anymore or who has time to do that, but that consistent rounding on the units. So that maybe it's checking in with the nurse manager or the charge nurse for the day. Hi, I just wanted to say good morning. I hope you have a great day. I'm here for you. Just that presence, that it's not only waiting for a referral, but just reminding the nursing staff, chaplains here, you know, they're available to help. They're available to come in and assess folks that you're concerned about. I didn't know how, again, with your experience, particularly in the acute care setting, what do you think about that? Do you think that that regular rounding, just checking in on the units with somebody in charge, would that help facilitate that collaboration better? What are your thoughts about that?
I can respond to that. So, so we have two chaplains one at St. Joseph's Hospital, where there's a large skilled nursing facility, and one at Ira Davenport in Bath, where there's also a large skilled nursing. And our chaplains, they have daily morning huddles with the medical director, nursing director, physical therapy, different people who are involved, social work. And the chaplains attend that meeting.
Okay.
And it really does improve collaboration and talk about issues that are going on. That's been a game changer.
Okay.
And at the hospital, the only unit, the acute units, the only unit where we have a regular presence at the rounds, interdisciplinary rounds, is in critical care.
Okay.
But that also has really changed the source of referrals and identification of patients who might need some extra spiritual care.
Okay.
So that it really does improve communication.
So,
And when I look back over the last few years, one of the things that I think has changed from COVID is that it really made spiritual care more obvious, the need for spiritual care, to the other members of the healthcare team. It improved collaboration with nursing and the medical staff as to who needed support.
yeah.
So that's a positive that came from the pandemic, I think, for us.
And thank you for saying that, Maureen, because again, in my experience, I think you are 100% correct that it became very evident that, wow, we need our chaplains here. And again, one of the positive things to come out of COVID, and what I hope that we can do is keep that momentum going. That's why, again, this presence, making making the rounds on the unit. Hi, just checking in, or maybe there could be I don't know if it's once a month or what. Everybody is so busy. Everybody's so busy. The acuity in the acute care setting is so high, and in the numbers that we care for. But would it be possible to even, maybe have like just a time when the chaplains can go for the nurses? Again, that we're here for you. Could it be like go to a unit, schedule it, that like you talked about the critical care area? Could there be, all areas, I'm not just singling out the critical care folks, but could there be, is it realistic? I'm asking you all that, realistic to hope that maybe there could be a regular scheduled time that the chaplain could come to the floors. We're here for you. Just how are things going? Are you finding any specific needs? A quiet place? Go ahead.
Yeah, I was just remembering that when I was at Sisters, the nurse educator there and a chaplain would go every Monday at 4:00, and they called it cookie rounds. And they would take a plate of cookies and they would gather together a huddle of the nurses on each of the units, anybody that could come for just 5 or 10 minutes. And they would ask for concerns, joys and concerns, and then they would offer a prayer for them. And the staff loved the cookie rounds, partly because of the cookie, but also because somebody was concerned about things that were concerning to them. So I think you're right. I think if there's and it can't take up a lot of time because I wrote down time is precious. And I know especially now, nursing is understaffed. So it has to be something that's small enough, but regular enough to be of meaning to people.
I think that is absolutely perfect. And look at, once again, you had that experience and you saw it in action. And how beautiful that chaplain and the nurse, that they're the team going together, right? They're the ones that kind of facilitated it. I think, again, I have not seen it done anywhere here locally, but maybe now's the time, going back to what Maureen said, that everybody recognizes the need of that chaplain, but we want that collaboration too. That's the point of this discussion, that, the chaplains are doing great as chaplains, nurses are doing great as nurses, but to bring that together, that relationship to enhance the care that we give to those that are in need, and it consistent, that it's not just in the critical care areas. In my discussion, like I said, my little kind of study that I was doing preparing for this, several nurses that I talked to were emergency room nurses, found that the presence of the chaplain was difficult. They found, not that they weren't going to say, no, I don't want the chaplain, but during that, all that was happening, that was the last person that they wanted. In other words, what the sense was, we'll call you at the end. In other words, somebody died, or then they bring in the chaplain. When that chaplain's there, they don't want that which that was surprising to me too, that I was thinking maybe that presence, even if they're not engaging in the event, but, oh, we know the chaplain is right here, but that wasn't an understanding. This was a very, just conversations, asking people their feelings about the collaborations they've had with chaplains. That were the few that the ED people, but again, think of what our emergency rooms are like right now. People are in hallways, so it was just an interesting conversation that I heard that I was surprised with.
Do you have did they say why? Like what was
I think,
uncomfortable for them?
and again, I wished, Mary Ann, we should have done it together. I wished that to ask those next probing questions. I think that the sense that I got was one more person in the mix. There's in the ED, there's just in this constant movement, and that one more person, almost, and nobody said these words. This is purely just me listening to what the responses were. Almost like, there's just not enough room. And again, remember, my conversations were maybe a handful, 4 or 5 people. So, at different areas that come from different areas. But again, that's a great question to ask. Why?
Well, from the chaplain's point of view, when I have been in situations that were codes or stroke alerts or in the ED, it's intense, and they're trying to do their best job, and they're anxious. I mean, it's not like things are calm and you're coming in. They have to act, and they don't want anybody in the way. And I think most of us get that.
Yes.
And at the same time, I can remember being in the trauma bay at Strong after an accident. There was a mother and a 3-year-old girl, and the 3-year-old was in one bay and the mother was in another one. And the mother was just like beside herself, wanting to get off that table and know that her daughter was okay. And the nurse is trying to get an IV in her. And so I just walked in the trauma bay and I said, just look at me. Just look at me. And I need you to know that we're taking care of your daughter. And I just talked to her, and that allowed the nurse to do what she really needed to do. But there were only a couple people in that bay.
Yeah.
But when it's packed and someone's bleeding out or having a heart attack or something, they're busy. They need the space. So I think it's incumbent on us as spiritual care providers to have a sense of when it's we can be helpful in the situation and when we need to wait. Because, trust that our time will come, our time will be there.
And Marianne, isn't that again another way to enhance that collaboration? Is there an opportunity to bring, again, maybe when you go to the unit for the cookies and in conversation, could you meet with the ED nurses and ask those questions? Like, what would you find helpful? What, if I'm down here, what would be helpful to, or however you would ask it? Wouldn't that be another way to enhance that collaboration between nursing staff and chaplains, you know?
Mhm.
And that cookies, I'm loving that. I'm loving the rounding with the student nurses, but could there be another way, you know? And these are the things that I think are important to talk about, you know, kind of circling back with the articles. We know it can be enhanced. How can we enhance that collaboration? And again, the nursing literature doesn't have a lot of scholarly work that's been done that talks about this. You'll find it in the, you know, spiritual literature, it's in the oncology, you know, in that area. So in the general kind of nursing research, it's limited, but again, there's a need now. This Dr. Elizabeth with her work and saying, we need more to talk about this and study this so that we can make those relationships stronger. And the bottom line is it's going to enhance the care. There's studies that looked at patient satisfaction when there's that nurse chaplain collaboration. You know, there are things out there like that, but I think with Maureen's point, with COVID saying how important that chaplain is, maybe this is our time to try to make those relationships a little bit richer and just a little bit more meaningful for the nursing staff and as well as the ultimate for the patient.
So could I interject at this point,
yes,
Leanne?
please.
Okay.
Yeah.
So one of the things that I do at Newark Wayne Hospital and the DeMay Center is walk and do the rounds. But I'm also online in the morning when they do, well, I'm only there 3 days a week. So, you know, everybody goes online because of COVID and chats about what's happening in that unit and so on and so forth. I don't usually have a lot to say other than, you know, please let me know, letting them know I'm available. And I think staying available and present and letting them know that I'm there is a big thing. One of the things though, and I'll give Ash Wednesday as the example. So, and they kind of kid me about it, but I make a little card up, you know, and go around to all the units. And what I do is make it available to the staff and the patients at both locations. So here I am with my little cart, driving it around for Ash Wednesday. But you would be surprised how many staff members said, I'm so thankful that you're here on the floor because I don't have the time to go down to the chapel or, you know, go down here at this certain time that you'll be there. So by giving that information, it's availability again, just being available, because then they get to know that you're there. And when they know you're there, then they can say, oh, hey, I just met the chaplain, you know, whatever. I'm going to give her a quick call because I think this patient or that patient might really like it. And there was one instance that I wanted to share real quick is I went to one of the floors, said, hi, I'm here wondering if anybody'd like to have a visit. Oh, well, we don't have any Christians here. I said, they don't have to be a Christian. I said, I'll talk about baseball too. And of course, they all giggled. And so she said, oh my gosh, we have somebody that loves baseball and would love to have a visit. Okay. So listen, I'm available to whatever. You know me, Leanne, pretty well, but the other gals, I'm sorry. So I went in, had the nicest conversation. Started off with baseball. Throughout the conversation, you can meld these two with your just talking about your ministry or talking about who you are, or why you do what you do. All I'm saying is it ended up with a prayer. Started off with baseball, ended up with a prayer. And now the girls know at that desk, at least at that moment, you know what I mean, that Oh, just call me, even if it's just about baseball. So just thought I'd offer that. Sorry about the dog barking.
you.
But just thought I'd add that into your conversation.
Thank you, Dawn. I'm just kind of looking at the clock and I want to be respectful of everybody's time, but I think I would really like to stress and just inform you, those of you in the acute care setting, you know about the JACO accreditation and, you know, the hospitals and all that. That is a standard that patients receive a spiritual assessment. That's a JACO standard. So again, when I was looking at the work preparing for this, I asked that question. So do you guys know what a spiritual assessment is? Do you ever do that? Nurses can't even answer that, but it's something that we're supposed to be doing. It's supposed to be being done. So it goes back to the point of, if we're trying to collaborate, we need to understand what has to be done in order to collaborate. How do we gather the information to give to the chaplain? How do we know the needs? We know the basic needs, those, you know, water, their hydration, are they having chest pain? Are they breathing? But the nurses are not being educated in how to do a spiritual assessment. I'm just saying at a very simple level, those very simple questions that you ask, nurses aren't doing that. Once again, we can, but that's not a part of what the expectation is in the nursing world. That's something else that's kind of been in the back of my mind with this, that in those times that we're sitting with people, would there be, you know, just making those cookie rounds? Would there be something that we could just talk about? What are the questions that we ask as chaplains? You know, nurses might not even be aware how those questions just give us so much information. So I think that's an important point that I wanted you guys to know, was that we are not, as nurses, getting that education about spiritual assessment. So that's a little bit of a challenge when that's not being done in order to have this collaboration. When do I go to the chaplain? How do I know? Are these things that I can take care of here at the bedside? Because again, Dr. Elizabeth tells us the nurses are the spiritual care generalists and the chaplains are the experts. You know, I just want to bring it back around to that. So getting that into the facilities, that's accepted and embraced, that yes, you can do this. We don't need to be threatened by the chaplain. We don't need to, you know, we're here to work as a team, to work together to enhance the care and really, hopefully, give that support at the time that's needed to the patients. I just wanted to kind of wrap up my part like that. I hope that some of this has been helpful. You know, I've been very blessed being here with you all and consider it a privilege to have had this experience. So thank you again to Mary Ann for inviting me. So
Thanks, Leanne. You did a great job.
thank you.
Yeah, thank you.
We have a few more minutes, but one of the things I wanted to say, Leanne, is I was thinking as you were talking about the intentionality that it takes to build those relationships, to do that kind of education, to do that kind of connecting. And should it be on the side of the spiritual care department or is it on the side of the nursing department? And that's where that collaboration piece comes together. It's like somehow we have to get together to make it work, right? It's not on one side or the other. It's
No. And I again, thank you for bringing that point up, because, you know, as I'm looking at these things, I'm kind of thinking, you know, processing right now in today's time. My opinion is that to try to do that work from this time would be generated from the chaplain side, just because the nursing side is not that the chaplains have a lot of really difficult things that are happening in chaplaincy, but that's the thing you hear all the time in nursing. We don't have time. So for them to be the people to, you know, kind of the catalyst, I don't think that's going to happen, Mary Ann. So I feel, could we as chaplains do that, you know, bring that piece just to start the ball rolling, you know, to start just getting that tightening of that relationship that nurses, we do know, and we do call the chaplains, but could it be better? That's all I'm saying, I, I would say, and again, her literature shows those numbers. The majority nurses do call the chaplains. It's not that it's not happening, but could it be just enhanced? Could there be better relationships? And the other thing is that follow-up, Marianne, after the chaplains see or do a consult or whatever, has been required, what's the communication back to that nurse? Does that chaplain go back to that nurse and, I want to say, give a report or a handoff at some level? I don't know how often that happens. So another way to enhance that collaboration, gee, I wanted you to know, I saw Mrs. Smith and this is what I'm thinking. I don't know that that happens as often as it probably should, So those are the things.
Well, and I know we've talked in spiritual care a lot about this idea of screening. When people get admitted to the hospital, a lot of times what they ask is, would you like to have a chaplain visit? Well, that's a loaded question. One, does anybody know what a chaplain does? It's a Christian term. So anybody who's not Christian is probably like, no, I don't need to see the chaplain. And that's the screening tool. So, my feeling is we're asking the wrong questions.
Exactly.
Like I'd rather hear somebody say, how anxious are you about this hospital admittance? And if your anxiety is way up, I think we'll send the chaplain, or how uncomfortable or how traumatic was this for you? There are other questions that we can be asking that aren't religion-based necessarily, but are definitely spiritual, existential kinds of questions that get at more of what we do as spiritual care providers.
And
Marianne,
again, with my group, that they said, people aren't even asking that question anymore. Like
Yeah.
you said, that was kind of the question. Because I said that, oh, remember we used to ask Leanne? They're like, Leanne, no, we don't even do that. So that screening, and you're right, maybe that assessment should be done by the chaplain, but that screening could be done by the nurse, couldn't it? Those initial questions to just get into that. That's exactly what would be a great way to start.
and I hate to say it, but chaplain, the term chaplain may even give people this idea that they're headed for death or something. I mean,
That's
it can
fair.
be a very negative thing. It's like, no, I don't need a chaplain yet. I've just got a kidney stone or whatever.
Yeah.
And so I think the connotation sometimes when you're asking for clergy of any kind, it's like, oh my gosh, I'm ending, my life is coming to an end, where it's like, no, you can just be asking to talk about baseball or something. Get my mind off of the fact that I'm having to be in a hospital for whatever reason. So I think Marianne, you're really on top of that with screening. You too, Leanne, about the screening bit. What are you asking people? Are you asking people because you're scared to die? Or are you asking about for a chaplain because you'd like to have a visit? It'd help your self, your physical self, your mental self. Let's face it, we're a part of it all. So I just thought I'd throw that in there.
Well, and I know this idea of nurses as gatekeepers. I don't know that they're gatekeeping as much as sometimes it feels like they don't have time for us. But like you get up on the floor, you might go to the charge nurse. Anybody need a visit today? Nope, everybody's fine. I got to get on. I'm moving on. But but then myself as a spiritual care provider at a unit, I still go see everybody. Okay, you don't have any concerns about anybody, but I'm still going to stop in and do my assessment. Like that's our job. We are the spiritual assessors, right?
Fact.
So nurses can really help with the screening and flagging, but really we should be seeing
Yep.
people, right?
Absolutely.
Totally.
Absolutely.
Totally. And again, when we did CPE, we were assigned to the units. That's exactly what I did. I did go to the charge nurse to introduce myself. Hi, I'm here again today. This is who I am. Is there anybody that you think? Sometimes she said that, no, we're all set. Sometimes she'd say, let me check with my nursing staff, but I still went door to door. Hi, would you like a visit? And that's as simple, because that's my job as a chaplain. You're right.
That's right. That's right. And it may start with baseball and end in a prayer. You never know. Because there's a
That's
lot
true.
of things that don't get talked about when you're in the hospital.
But I think it's about respect as well. You know,
Mhm.
from a chaplain to a nurse, nurse to a chaplain, I don't
Right.
care who it is. I think it's about respect. And when you get that respect and that rapport with other people, regardless if it's a doc, if it's whoever it is that you're working with, the family, the patient, it doesn't make any difference. You have that mutual respect so that you can talk about whatever needs to be talked about and be there, be available. So I agree with you guys completely.
So again, if you look, I'm going to just for, that's who I am. I'm just going to reach out to this Dr. Elizabeth Johnston Taylor at Loma Linda.
Ooh.
I just wanted, maybe it'll be a quick email. You know, we had this lunch and learn with Crossroads of Caring. We talked about your article, just to make that connection with her, because I think it's important too that our work is identified and valued. How she would think, I would think she would be very happy to know that in Rochester, New York, Crossroads of Caring is having these great lunch and learns, and they're talking about her literature, and the other gentleman as well. You know, he's an educator somewhere. I can't remember where he's from, but if you get the chance, just, they're very easy reading, but I thought it was informative, and I most especially love the ideas of that, those new students, those students making the rounds with the chaplain. Beautiful. I'm so excited to hear that, Maureen, and also Mary Ann's, the cookies, that nurse manager and that chaplain going together for that staff. Outstanding. And I don't think that's not being done here in the Rochester area. So exciting, exciting. Thank you for all your sharing. I hope
Yeah.
this was helpful.
Man, thank you.
Yes, thank you. Thank you, Leanne.
Yes, thank you, Leanne.
So our next Lunch and Learn is in March on the 18th, I believe. It's the third Thursday of the month, 21st. Oh, no, I'm wrong. 21st of March. And Regina Carpenter is a professional storyteller, and she's also a chaplain at Arnett Ogden Medical Center. And she's going to talk about her experience as an adolescent with mental health mental illness, and what that was like for her. So I hope you can come back and see us on the 21st, and we'll have that for you. And Leanne, again, thank you so much for being here. It was a wonderful conversation. And Maureen and Dawn, thank you for contributing so much to the conversation.
Yeah, thank you. Thank you for having this. This is great.
Nice to meet you, John. Nice to meet
So
you.
now, Marion, when will this be available? If we have, like, these colleagues that I talked to, I'd like them to see this.
So it takes a little bit for the Zoom to upload to the cloud, but it'll be up on our website, I would say by tomorrow afternoon.
Okay. Thank you very much. Nice to see you all.
Good to
Bye,
see
everybody.
everyone.
Bye-bye.